您是否曾经在你的胸膛和腹部之间有过几分钟或长达几个小时的疼痛感觉？您可要注意，因为那可能是溃疡的症状。
Pag sinabing peptic ulcer disease, it's a lesion sa stomach wherein the area ng mucosa is quite deep. No? Actually, we call that excavation. So parang butas na kulay puti. It is secondary to caustic effects ng acid, or it could be also secondary to H. pylori infection. Ang H. pylori is a bacteria that resides in the stomach. So if you have that bacteria, that can cause ulcer in the future. There are also causes of ulcers, no? Such as intake of medicines, especially mga antiplatelet medicines, aspirin, clopidogrel, or even stress actually can cause ulcer also. Actually, it is quite common, especially in most of the Asia-Pacific region. Like in the Philippines, in 1996, it's about 36%, and right now, 2002, it has decreased to about 18%. However, the complications remain stable. Complications such as bleeding from the peptic ulcer.
虽然溃疡可以在以上的状态而被引发，但是它是可以避免和治疗的。
Number one, if positive sa H. pylori, then you have to eradicate it. You give antibiotics plus anti-acid medicine. The other thing is prevent intake ng unnecessary medicines such as aspirin, clopidogrel. Now, if the patient really needs antiplatelet therapy, kasi ito yung mga gamot na labnaw ng dugo, no? Especially for elderly patients. The other thing is avoid stress also. No? We have just mentioned a while ago na stress itself can cause peptic ulcer disease also. Then maybe yung mga pagkain, try to limit na too much mga spices, caffeine.
若您有溃疡 ，Manila Doctors Hospital 的顶级医疗设备可以帮您治疗各种各样的病情，也是本国最出名的医院。
If they have abdominal pain, then it's better na magpatingin po sa doktor. The other thing is, if the pain is very severe, sometimes they have to undergo examination, and one of them is endoscopy. By the way, ang peptic ulcer kasi is usually diagnosed endoscopically. Clinical diagnosis is quite difficult kasi any like hyperacidity, dyspepsia, all of them have the same symptoms of peptic ulcer. Most of these patients na a-admit with peptic ulcer are secondary to complications such as bleeding or even perforation pag nabutas po yung ulcer. Dito po sa Manila Doctors, if there's bleeding peptic ulcer, what we offer is endoscopic therapy. We can do injection. We have coagulation here. We call that APC or argon plasma coagulation. We have yung isa sa mga newer techniques in controlling bleeding, the hemospray. We can do also clipping. So if patient is experiencing abdominal pain, especially severe, advise to see a doctor, no, para ma-evaluate where is it coming from. Kasi mabilis magbigay ng gamot, but if the cause is different, then hindi rin tatalab po yung gamot.
下次您腹部之间若有疼痛的症状，在变得严重之前，记得找医生帮您检查。别忘了去 Manila Doctors Hospital， 他们的医疗设施是最先进的，同时他们也有良好的医师团队。